So the topic that I was asked to speak on is athletic trainers. And when it comes to athletic trainers, dealing with, welcome guys, I feel right at home here. Teaching the classroom as well. Yeah, there we go. So I was asked to talk about athletic trainers and youth sports and how they're going to relate. So it was recommended to me that the title of the presentation be Smart Care for Athletes, Certified Athletic Trainers. So that's where we're at on it. Okay, so what I first want to do is make sure that everyone in the room understands who we are and what we do, and maybe in addition to that, maybe who we aren't, right? Because sometimes it's a little more about who we aren't before they can begin to understand who we are. So athletic trainers are highly qualified, multi-skilled healthcare professionals. We have specific training that overlaps with many different allied healthcare providers as well. So some of that specific training, it would be prevention, emergency care, examination, diagnosis, treatment, rehabilitation. In the state of Utah, we are licensed healthcare professionals as well, and many times that's a common misconception that we are oftentimes mistaken for personal trainers, and no offense to personal trainers. They have a place, they do an amazing job at what they do, but they are not medically trained, right? They have their area. So there's a little bit of overlap there, but not understanding the medical side of it, the licensed healthcare side of it. Sometimes we're going to talk a little bit about that and how that sometimes gets in the way of relationships and how they go. So where do we work? Well, personally, I work in the secondary school setting. I've also worked in a physical therapy clinic back in the day. But a lot of different places. With reference to this conference, like youth sport leagues, youth sport facilities, you may find an athletic trainer there. Many are now being employed with physicians and in private practices as well. Hospitals, the performing arts, for instance, Cirque du Soleil down in Las Vegas, lead medical there within Cirque du Soleil would be athletic trainers. Kind of running the show there. Clinics, commercial settings, like maybe at a power plant, doing some work hardening, trying to figure things out. And then police, fire departments, and currently in branches of the military. So pretty widespread where the jobs are at, right, for the new bunch. So athletic trainers are recognized by the American Medical Association, Health Resources Services Administration, and the Department of Health and Human Services as allied healthcare professionals. So a lot of what I'm going to talk about is going to kind of come from that. So I'm going to show you a little video here. Hopefully it's going to work. This comes from a video that we produced actually here on BYU's campus many years ago, about 2005, I believe. So you're going to, I think, recognize this face.
In the next few minutes, we will hear athletic trainers, professional athletes, coaches, and parents explain why athletic trainers are necessary for athletes at all sports levels.
Athletic trainers, they're kind of the glue to a team. They act as a safety net. Everybody has a job. The coach needs to coach, but also get his players on the field, and he wants them to play, and players want to play. And for me, the trainer was always the guy that could give, or the girl that could give me the advice to say, I have you at interest. I have your body at interest. I have your health at interest. You might not make the right decision. The coach might not make the right decision, but the trainer will. And I think that was the key for me.
One of the primary roles of an athletic trainer is to help prevent injuries before they happen.
Last year, I wanted to go back in and play, and the trainer wouldn't let me. The coach, I'd had a concussion. The coach doesn't know. I say I'm fine. And if the trainer's not there to say, hey, look, that's not a good idea, I'm back in the game. And that's happened, that's just last year. I mean, over the years, it's happened 30 times with different injuries.
Hey guys, in the back, do you know who this guy is? Yeah? okay? Because that was a long time ago, right? So Steve Young, quoting him, right? Athletic trainers are the glue that holds the team together. So too many times, overlooked, right? Overlooked, undervalued. So let's talk a little bit about with our adolescent sports. Injury prevention through conditioning and warm-ups, right? So a lot of education on the fact that that's an important thing to do. You don't typically see the athletic trainer out there like leading the conditioning and warm-ups, but we do a lot of kind of behind the scenes. This is what you need to do to avoid something or to come back for a certain injury that's there. At certain levels or with certain teams, maybe even consulting with coaches, right? If we have a certain number of specific injuries that are occurring, we might go in and have a conversation and try to educate on what's there and what we think can be done to maybe help out and maybe ward off some more that are going to be coming. Immediate care on the field. Concussions is always a hot button these days, right? But it's not just concussion care that's there, sprains, strains, fractures. I mean, we can go down the line on that immediate care on the field. Managing return to play decisions. This is an area we're going to talk about a little bit about a few slides from now. But managing those decisions sometimes really does become a challenge, right? Because there's a lot of people that want to manage the individual athletes. So we'll talk a little more detailed about that here momentarily. And then educating athletes, coaches, and parents on overall general health and wellness. That's just the tip of the iceberg as to what athletic trainers can do in adolescent sports. So why then do the adolescents actually need the athletic trainer? This picture hopefully caught your attention. That's a good amount of blood coming down his leg. This is one of my former football players. This happened during a game. Young athletes are still growing. They may look in stature like they're adults, but they're not adults, right? I have to tell parents and coaches all the time, this is a child that just happens to be way up here, and they think that they're adults, but they're not there yet, right? So we're talking about the skeletally immature individual that needs to be treated a little bit differently. Super vulnerable to overuse, as well as our traumatic injuries that come. I want you to just think for just a quick second. Let's just talk about football just for half a second. On a high school football team, I have 14-year-olds and I have 19-year-olds, right? And they're going up against one another. So when we start to talk about skeletal immaturity, they are definitely at different levels, right? It's not all the time we get that 14-year-old that goes up against the 19-year-old, but it certainly does happen. Those that come to us, with some pretty good God-given talent, it's certainly not unheard of to have them on the same playing field. Our adolescents are really good at downplaying their injuries. Why? Part of it is their lack of filter. Part of it is the example that goes on around them, right? Part of it is their desire is to please the coach, right? If I don't please the coach, I'm probably not going to get to play, right? And they go home and they got to please mom, they got to please dad, they got to please coach, they got to please, their peers and everybody else. So somebody else needs to be there looking out for their best interests. Even Steve Young, right? He admits, look, this has happened 30 or 40 times. I say I'm okay. And we're talking about a full-grown professional athlete that's out there saying they're okay. So for us to expect that the children are going to come at us and just be straightforward is probably a little bit unrealistic. Coaches really just are not medical professionals. Occasionally, we do have a coach that's a medical professional. But when that coach is the medical professional, they're usually there to coach, right? They're not there to be the medical professional. So the athletic trainer is the one who can fill that gap. Early intervention has been proven to prevent some long-term issues. So the quicker that we start to intervene on behalf of, I'm going to call them the children, right? The quicker that we intervene, the better off, or the better we hope the long-term outcome to be, right? If we want the best outcomes, we need some pretty quick intervention. So The athletic trainer has the best interest of the athlete in mind, right? When I go to work every day, that's my job. It's not my job to win, right? But it is my job to ensure that, 20, 30 years down the road, that they can come back and see me and that they're in a healthier state than they otherwise would have been, maybe if I wasn't around. Which brings us to the relationship with the coach, right? What is that relationship? Is it hostile, right? Is there a lot of confrontation? Or is it a relationship that's built off of trust? Because it would be ludicrous for me to go to my coach and say, hey, I really don't like that play that you called. So next time, could you call it like this? Like, people think an athletic trainer is not going to do that. However, a coach might go to the athletic trainer and say, I need him back. It's fine. Get him in. Right? So is there a way that we can have trust on both sides? That as a medical staff, we can trust that the coach is doing the right thing, going to try to keep our athletes out of harm's way, try to make our job a little bit easier, and it's their job to coach. And it's my job to be there to protect that youth that's there. I also need the understanding of the parents. That I understand that that is your child and you might think you know what's best for your child, but in this arena, I might know what's best for your child, right? And in a court of law, the typical thing there would be, well, if I would have known what she knew, I probably wouldn't have pushed it, right? But he or she knew better. Why did they allow that to happen to my child? So we have to have relationships. And again, that relationship between coach and athletic trainer is so vital. When it comes to our adolescent sports, where are we at on it? If I work at a college setting, I probably am working with one team or maybe one primary sport and one small sport. But at the high school, I'm working with 27 teams simultaneously, right? So that's a lot of relationships that have to be managed there. So as long as we can establish it on trust, if we don't have trust, we need to take it behind the scenes, right? Then those conversations need to be had prior to, and we need to agree as to what it looks like in the moment. And I've been at Springville a long time. I have great relationships on my campus. Oftentimes said, how did you do that? It's like a different world. When you step onto that campus there at your high school, there seems to be this level of trust. Where did it come from? Well, it comes from one, I'm not a dark hole. If your athlete comes into me, I'm not going to suck them into the dark hole and you're never seeing them again for the rest of the season, right? If I have to do that, I'm going to do it. But they understand that it's done with the best interest of the athlete in mind. And those cases are few and far between. I also have an advantage, the continuity of care, in that right now many of my coaches were once upon a time my athletes, right? Which is very helpful. So with some continuity of care that goes on there. So again, the coach needs to coach, the athletic trainer needs to be in charge of healthcare, and when we have others that step onto our sideline, they too need to understand what the role is with everybody that's involved in that. One of the things that we focus on big time is our EAPs, or our emergency action plans. Look, an airplane is not going to take off if they don't come down the aisle, find out who's seated in the emergency row, do you agree, and this is our plan, right? They ask everybody, put your cell phones away, turn them off, let's have the conversation, what if on this airplane? Well, I would say we're much more apt to have an emergency occur on one of our plane surfaces than to have to utilize the emergency action plan on a plane. But they tend to go overlooked, right? So nobody likes to put them together. I don't like to put them together, especially the fact that they have to be venue specific. And how many venues do we have to deal with? And then we have to teach everybody at that venue what's going on. Our action plans are not just venue specific, but in many cases, they are specific to what's going to actually take place there. Are we going to have a heat problem, a heart problem, a head problem, a hemoglobin problem? Those are our big four killers in sports, right? And then we've got the everyday stuff that happens, the musculoskeletal issues, environmental issues, lightning in the area, what are we gonna do? And everybody doesn't like you, right? When you call them off the field. But they're still necessary things. We have illnesses that occur. Look, we don't like to remember back to 2020 when COVID hit the scene, but can I remind everybody that what occurred with at least the big bad shutdown that March of 2020 was somebody on the Utah Jazz tested positive and they were out of town, and who got them home safely? It was the athletic training staff, right? So illnesses come up. We have to figure out emergency action plans. Where are we going to be with all of them? Because we're here and I have you as an audience, I want to go over sudden cardiac arrest, because this is just one of the emergency action plans that we have. So if I could direct your attention to up here, this is comes off of YouTube. Anybody out there can go to YouTube and find this, but I think that everybody needs to watch this because this is just one example of how things can happen.
Hi everyone, I'm John Dresner, Director of the UW Medicine Center for Sports Cardiology, and in the next 100 seconds I want to show you how to recognize sudden cardiac arrest in an athlete.
He can be seen coming out of a timeout huddle, his head dropping. He stumbles, then alarmingly, he falls face first.
Here you see Keontae head drop, stumble, sudden collapse. This is what sudden cardiac arrest in an athlete looks like.
And collapses, just like Hamlin did, in sports from football to lacrosse to baseball.
In Mark Vivian Foe, he shows all the signs of sudden cardiac arrest: continued breathing after collapse, eyes open and rolled back, the face of sudden cardiac arrest. For Damar, after his arrest, his arms go up with seizure-like activity. And for Christian Erickson, a sudden collapse, also unresponsive, eyes open, brief seizure activity in his leg. This is sudden cardiac arrest.
We've been there, but that's not a good look at all.
With Claire, dramatic episode, collapse with seizure-like activity in the arms, an amazing emergency response. Call for help, someone go get the AED. Remember, in a collapsed athlete that is unresponsive to verbal stimuli and a shoulder tap, you must assume it's sudden cardiac arrest. Call for help, start chest compressions, get the AED. Anyone can save a life.
For those lives to be saved, somebody had a plan in advance, right? So I show this to all of my coaches, I show this to all of my athletes, and I follow it up with this. If this happened to you right now, where's the nearest AED? So let's ask this room. Yeah?
It's outside the registration desk.
Outside the registration desk. Did the rest of you know that? If we yelled and said, somebody go get an AED, Lizzie would have been able to go, but the rest of us would have been here just wondering what to do, right? We would have had a whole bunch of people trying to call 911, and then we would have responded, but what is the best chance? An AED, right? So that's just one example of emergency action plans and some things that athletic trainers are typically the ones charged with doing behind the scenes, right? So that would be an emergency action plan that shouldn't be just told, hey, we have a plan. It's something that needs to be rehearsed. It needs to be gone over every year. And we now have gone even further in that in the world of athletic training, we have something we call the medical timeout, or in Utah high school, we have retermed it because I don't like the name medical timeout, right? Because they take medical timeouts all the time, right? So we call it the pre-event medical meeting, which occurs. It's been occurring at the professional level, at the collegiate level, and now we try to put it into the high school level anytime possible, that we have a set time that we meet with the officials, with administrators that are there, if we happen to have an emergency crew on site, but everybody just gets introduced to this is who is who, and this is where we would bring them if we had to. This is how we'll notify the crowd. So emergency action plans are a big one. I would say if you think that Damar Hamlin survived by chance, that he just happened to have the right people and the right things in the right place, you're mistaken. Because there's a lot of planning that goes into that. There's a lot of planning. For a few years, I did medical oversight here at BYU football. And I had to arrive hours prior to the game, where we were all called together to figure out what is the plan. What are we going to do if? If we have an environmental, it looks like this. If we have, something on the field, it looks like this. So a lot of coordination goes on, and that's just one advantage to having an athletic trainer at least available. So really, what does it cost to not have one, right? Most time when we say what does it cost, people are thinking financial. Financially, what does it cost, right? They'll say, I can't afford one. I would suggest if you can afford to have athletics, you can afford to provide medical care for those kids. They need access somehow, some way. We need to have access. What does it cost the parent if you don't? Well, there's an increased out-of-pocket expense for the family. Because maybe there's some unnecessary medical visits or consultations. Maybe they went to the wrong doctor. When we're talking about adolescents, most of our parents are thinking pediatrician. And I think pediatricians are great, and they certainly have their place, and many of them have great training. But in the world of athletics, does the pediatrician understand athletics? Sometimes they do, and sometimes they don't. Right? I can tell you there was a lawsuit once upon a time because a physician cleared an athlete back to play football following a concussion because doctor thought football meant soccer and said, don't use your head. Right? It could be as basic as not understanding the sport. So, going to the right medical provider, and again, I'm not going to say that's not the pediatrician in the event of an adolescent. And many times our insurance companies have to dictate where we go, and then we follow the process. But sometimes, if there's an athletic trainer or immediate health care, maybe they didn't need to go at all. Right? So, unnecessary medical visits, that could be one of them. Recovery costs, extended recovery times due to delays, right? How long does it take to get into a physician, right? How many times do they get in there, and by the time they got in there, they're better, right? But now the coach is mad because, again, that's that dark hole I was talking about, right? The coach is upset because, well, they went and they couldn't get in, and now the season's coming to an end, or now we find out they were actually okay. So there's a lot of things that can be done, and recovery time really, to me, falls into the cost category. Long-term cost. What if it's improperly treated? Maybe it turns into a chronic injury. And for those who don't understand the term chronic, that's ongoing, reoccurring. It didn't happen just one time, go away, and you're good, right? It's the ones that come back or hang on for the long term. Sometimes that affects their long-term performance, right? And with our youth, long-term performance might mean they have to give up on their sport. It might mean they have to switch a sport. It might mean they didn't make it to college to play that sport. So there certainly could be a cost associated with that. As far as an organization goes, could be some legal ramifications, right? If somebody steps outside of their scope of practice there and decides to be medical, that's not supposed to be medical, and something happens, there's typically a lot of attorneys that are waiting to try to maybe do something. on behalf of that situation. So that, I think, needs to be for sure taken into account. For the athletes that are in the room, how about the emotional cost, right? Our athletes are socially wrapped up with their teammates and their sports and with all these things that they want to do. So there could be an emotional cost to them. Who do I listen to, right? What do I do? Do I get to play? Am I done? Am I going to be better? When am I going to be better, right? Maybe I'm okay. So there's a lot of emotional stress and emotional demands that we already place on our youth when they're in sports. To put one more on them when it comes to injury and when to speak up or not, I think is asking too much of the children. We don't ask that of our adults in college. We mandate that they have medical care. We don't ask that of our professionals who are adults. We mandate that they have medical care. But for some reason, we won't mandate that our children have medical care. We kind of hang them out to dry and say, oh, there's all this little, smattering of individuals and somebody's going to look out for you. Physically, delayed treatments, they can get worse, right? They lead to increased pain, decreased performance, and potential long-term damage. So where does the athletic trainer play the role there? Most of the time, an athletic trainer has enough connections to get somebody in that door much quicker than they otherwise would have gotten through that door. As athletic trainers, we must collaborate with physicians. Our state law says that we do. So we have a relationship somewhere with at least one, but in my case, I probably have 15 to 20 physician phone numbers that rather than going to the front office, I just go straight to who it is after a consultation with the parent, right? We don't jump the gun and say this is where they have to go, but we certainly consult and then can offer up some suggestions. And those relationships that we develop play a pretty good role in that. There's a lot of data that supports what I've said. Most of what I've said is not simply my opinion. It came from somewhere. It came from me reading about, being educated on some of its opinion, and then it got verified. But there is certainly a lot of studies out there that support the fact that our adolescents need health care. The athletic trainer really is that professional that's designed to do that job most efficiently and most effectively. Some basic things. Look at the one, reoccurrent injuries were notably more frequent in schools lacking athletic trainers back in 2018. 6 times higher in soccer and 3 times higher in basketball, right? And that's just one. Sometimes it's perceived, if you have an athletic trainer, you have more injuries. And it's not that you have more injuries, it's that more injuries are identified quicker, but we typically can get on it and get them back quicker as well. So the old adage of, don't tell is not a good way to live. Telling is your quickest way back. The athletic trainer can help the young student athlete to figure out when that hurts. That's what sports are all about, and that hurts, versus that's an injury, and we probably better do something about it. This one, if we do this and this, you can carry on, or maybe we have to pull you back for a while to get the best outcome, right? But the athletic trainer really is the person who's there to identify that and to help. That goes back to that educational piece.
Event or like the games, basically.
Okay, so the question is, in high schools, you're more apt to find, right, an athletic trainer that is working out of that, right? That's your experience. But when you get outside of that, now what?
Yeah.
And my answer to that would be, if the organization doesn't have somebody for you, and it's unlikely that they do, there are athletic training, I guess I'll call them companies. They do what's called per diem work. So you can hire an athletic trainer for an event. You can hire them for a game, you can hire them for a tournament, right? And you will get somebody different all the time, so the continuity of care isn't necessarily there. But access to somebody for that in the moment, I think essential, crucial, and if I had my way, it would be state law. But I'm not in charge of that. And if you're interested in who it is, I'm happy to talk to you. after.
Thank you.
Yeah.
With your experience with legislature, where do you hope to see the field of athletic training progress towards? Is there anything you can think of?
Well, the athletic trainer needs to stay the licensed healthcare professional that they are. I would like to see it mandated that every high school that has an athletic team is required to have an athletic trainer. Right now, they say that would be an unfunded mandate, which is why they don't do it. But we do know that somewhere between 60 and 70% of the schools in the state of Utah do employ athletic trainers. Unfortunately for our small town people, that's typically across the Wasatch Front, St. George, and then up north. So when we start to get rural, we start to have a problem. And the latest research also shows that the further we are away from a hospital, and then there's no health care, the greater the chance of a fatality happening. So it's a little backwards. But if we had a mandate, schools can find a way. It's a matter of prioritizing. I've been involved in discussion when more than one new school was opening. And I each time had been disappointed to find out that the number one hire was the football coach, not the athletic trainer that could oversee all the athletes on campus. But they kind of would pick and choose, and then the athletic trainer became an afterthought. So I think with a mandate, I think we can make it happen, right? And I think with some prioritizing on behalf of school boards, PTAs, superintendents, I know that there's a very viable way regardless of the size of the community. And I'd be happy to talk to anyone about it, but there we go. Anybody else? Another one?
Another one. What is something that we can take away as an audience on how to make a mandate happen? Is there anything we can do?
Anything that the audience can do to make a mandate happen? You could go grassroots and contact your legislature. Whoever it is that you are their constituent, they will listen to you. And if they truly have the best interest of the youth in mind, they would hear you out and not put a we can't afford that price tag on it, but let's find a way. But without the support of the general population and educating them on who athletic trainers are, what we do. Again, early in this, I said sometimes it's more important to know who we're not rather than so that we can identify who we are, because too many times things go wrong at the state legislature because they believe that we are not medical. They believe us to be more along the personal trainer route. We're that guy or girl who carries a water bottle and has a roll of tape and a towel over the shoulder, and they don't see that other side. There was a heightened awareness with Damar Hamlin. Grateful that he had a favorable outcome, right? But then picked up a lot of steam on that, but that kind of gets shoved back underneath again. And we just don't need to have a fatality to make it happen. I'd love to see the general population get on board and our legislature have them get on board to be proactive rather than reactive, because I don't think anybody wants to donate a child for the cause. Right? Yeah, good question. Anyone else? Hey boys, any questions from you? Since you're the athletes in the room. Can I ask, do you have an athletic trainer available?
Yeah.
Do you have a relationship with the athletic trainer?
Yeah, I'll say so.
Trust him?
Yeah.
Great. That's awesome. I like to believe my kids feel that way about me too. So hopefully. Okay. Anyone else? No? All right. Okay. Thank you very much. Appreciate your time.
As an intermittent between this and the next breakout session, I brought you all cookies if you didn't get enough.